those who are struggling can start to seek recovery. One option is through Outpatient Detox.
That's right. Here to explain what Outpatient Detox is and how you or your family can get help is Chief Crisis Officer Christy Boyle. Thank you so much for being here.
Thank you for having me.
And I had a trip to chance to head out there about a month or so ago, and the concept to me was a little new. I wasn't familiar. I'm familiar with, like, you know, you get dinged up, you go to the urgent care, but this is something that's similar but different. How can you maybe explain?
So the mental health urgent care is for those suffering with mental health crisis, or they're just looking to get access to care. Everybody knows that there's, you know, an opportunity for people to get care, but sometimes it's not quick enough. And so with the mental health urgent care, they have that opportunity to come in, be seen that day. We take all walk-ins from 10 to 6 and kind of streamline their care to get faster care so we can get to the problem sooner.
When it comes to things like outpatient detox, who is that for? What does that mean? You always think people have to go and be admitted and have this time period, but you're saying outpatient is also a possibility.
Correct. So one of the entryways through the urgent care is to go to outpatient detox. And so we treat all addictions, but we also provide Vivitrol and Suboxone. So these clients can come in, get assessed, see what their need is. We treat them right there on the spot, start treatment for whatever substance they're using, and then they stay for whatever amount of time that may take. They get to go home at night. Come back the next day for day 2. We make sure that they did okay overnight. We assess if they need an adjustment in medication or more comfort meds or more wraparound services, and then they go home again and they can come for day 3. Not everybody needs that many days. Some are shorter, but we do that assessment the whole time that they're with us, and then we wrap around services for them upon discharge from outpatient detox, whether that's with us at Harbor, another agency that they currently belong to, or they want connected with another agency. We will help them in any way possible.
One thing I thought was really fascinating is in the time we live in, we talk a lot about people who are having mental episodes, and it could turn into a life and death situation. And I think there's not a lot of places for individuals who may be experiencing that or their family members to take them. But this opens up a place that someone who might be experiencing this could go to. Is that sort of the thought process behind the urgent care part of it?
Yes, the urgent care is for youth and adult, which is another kind of a new concept. You come in, we have behavioral health technicians, we have peer support, we have therapists, we have nursing staff, we have a psych MP on staff, and you get that same day service. You're having that crisis. We'll evaluate you to see if we can wrap around services for you to keep you out of the hospital, or if we do deem that you need that next level, help you get to the hospital, get that report called into the hospital so that they know you're coming, and make that transition a little bit more easier for you.
And when it comes to, just back to the outpatient detox, you do the withdrawal support. So that's the other thing that people don't, they're afraid to do it on their own, and you're not on your own. You're watching the withdrawal and monitoring.
Absolutely, the whole time. And when you came to the urgent care, you could, our treatment bays are really kind of really neat. You can see into them all the time. Our provider's sitting right outside the window to make sure that you are comfortable, things are going okay. We have people that continuously meet with you, whether it's our nursing staff, our addiction case manager. They are constantly making sure that your detox is going okay, and making sure that if you do show any signs of crisis, that we get you to that next level of care.
Is this a common, and I remember when I went there, is this a common new venture towards mental health awareness? Because I feel like there's not a lot of these around. Do we know a number?
I know that Zeph Center has an urgent care. Those are the 2 newer ones in this community. I think that it's so important that we treat mental health like we do any physical ailment. And having mental health urgent cares pop up and it be as common as, oh, you know, I have a toothache, I'm going to go to the dentist. I'm having a mental health crisis. I'm not feeling well. My depression, anxiety, both for kids and adults. I have somewhere to go. I have somewhere to go that day and get treatment.
I like that there's a spectrum here for you too. If your family is going through this or someone is going through this in your family, it's not one way or another. You're able to give them kind of an array of care so that it works with whatever the situation is for them.
Correct.
All right, so we want to get the details,
Yeah,
right?
the best way, I remember it's over by the Franklin Park Mall, but exactly where is it and it's open 24/7, is that correct?
Not yet.
Okay.
Right now we're open 10 to 6.
10 to 6.
We ask that anybody coming to Outpatient Detox show up before 2. That is in case we do have to start a medication that we have time to observe, and our pharmacy is on site, which is phenomenal. And then we're at 3909 Woodley. You can go to harbor.org. All of our information is there. Our telephone number, super easy, short, harbor.org, and find out any information that you need to get into the mental health urgent care. And you can just show up.
All
Well,
right.
appreciate you. Appreciate your work as well. Thank you so much for being here
Thank you for
today.
having me.
Yep, for sure.